for a hearing on docket number 0662, implementing changes for safe streets during and after the COVID-19 pandemic, sponsored by Councilor Liz Braden and myself, and referred to committee on April 29th, 2020. We have had one hearing on this topic previously, and so today are back for a follow-up hearing. I'm pleased to be joined by several colleagues on the City Council, including Councilor Ed Flynn, Councilor Kenzie Bach, Councilor Julia Mejia says she will be in and out. She was here earlier. I think she will come back soon. Councilor Matt O'Malley. I'm going to do a quick scan to make sure I didn't miss any other colleagues. Okay, great. So what I would like to do is just give colleagues a chance to give a quick opening statement. Then we will go to representatives from the administration and from advocacy organizations, and then straight to Q&A. Councilor Flynn.
Thank you. Thank you, Councilor Wu, for your leadership on this important issue. Thank you, Councilor Wu, Councilor Braden, for bringing this matter forward for a hearing. It is important that we have measures in place that would ensure the safe travels of our residents during this pandemic. I also know that the city has put forth a healthy streets plan a couple months ago, and I'm glad that the city is taking proactive steps in thinking and implementing what we should change in order to accommodate the need for physical distancing, need for reliable transportation, and helping our small businesses. Pedestrian safety is a critical issue in our city. It's probably not an issue I've focused more on than pedestrian safety, making sure our streets and sidewalks are safe for everybody, for our cyclists, for our residents that are walking, for people driving. The other issue that I always focus on is critical that we reduce the speed limit in the city from 25 to 20. There's been a lot of accidents lately. I talked to my friend Corey Dinopoulos in South Boston yesterday. He wanted me to highlight that as well. But pedestrian safety, road diets, dedicated bike lanes, bump outs, everything is critical in making sure that our public is safe. I'm here to learn more about and any updates we have in implementing our Healthy Streets plan, as well as to hear from advocates about how we can further improve on this existing plan and street conditions as well, to ensure that the implementation of these plans are equitable and transparent. I also want to thank the Mayor Walsh team that is here as well, and for implementing a lot of the pedestrian safety related issues that I've focused on, especially in my district. Thank you very much, Councilor Wu.
Thank you, Councilor Flynn. Next up is Councilor Kenzie Bach.
Thank you so much, Madam Chair. I want to echo the thanks to the BTD team that's here, Vineet, Jacob, I think I saw Stephanie, and Matt, and just say that I'm very excited about the Healthy Streets things that we have seen implemented. I think a real highlight for me has been finally getting the temporary bike lanes around the Common and the public garden. And I see folks using those all the time, and very interested in the path to making that permanent, through the appropriate public process. And I just want to note that, those are bike lanes that they're used by folks in the neighborhoods adjacent. I've seen people teaching their kids, how to ride bikes and stuff in them, but they're also, I think, a critical connection for folks coming in from the Southwest Corridor type area, making that commute possible for essential workers. And so really appreciated that. Would love to see us be doing more. And I think, both on the cycling side and as Councilor Flynn mentioned on the pedestrian safety side, would love us to kind of be doing more pedestrianization and extending of sidewalks in this time. And so, and I think sort of explicitly extended sidewalks hasn't necessarily been part of our arsenal yet. So would love to talk about that today. And yeah, just really grateful for the work that the team at BTD is doing, and grateful to all the advocates here from Walk Boston, Cyclist Union, and Livable Streets. And just, I think, as with so many things, as we've all discussed at length, like, now is the time, right, for us to seize as many of these opportunities as we can, because we really see what it means for for people to live in the city. Like we've taken away some of the passing through the city. And so you really kind of see the shape of what life in the city looks like. And life in the city should look like being able to get around in a carbon neutral way really safely. And I personally was really shaken by the bicycle fatality earlier this week in Cambridge. My sister rides her bike in Cambridge all the time. And it just reminds me again and again how really like the vehicles that should be guests in our streets, especially in a city like Boston, are the large trucks, not the pedestrians, not the cyclists. And I think, even in the pandemic, we've seen often with streets being a little less trafficked, you see some of the speedway issues that Councillor Flynn referred to around places like the parks, get worse. And so that's why I think I've really appreciated the bike lanes, both for what they do for cyclists and for the kind of street slowing factor that they have, and just really looking to do this all throughout the district and all throughout the city, and think about how we get safe cycling infrastructure all the way out to Mission Hill in my district, down to downtown. So thank you, Madam Chair. Thanks for convening a follow-up conversation here, and thanks again to all the participants.
Thank you, Councillor Bach. I see we have also been joined by Council President Kim Janey and our lead sponsor, our co-sponsor, Councillor Liz Braden. So we'll get to them as we go through the order. Next up is Councillor Matt O'Malley.
Thank you, Madam Chair. Thank you for your leadership on this issue, as well as Councillor Braden for bringing this to our attention. Great to see so many colleagues and friends and tenacious advocates on this Zoom. Delighted to be with all of you. I will say from the offset, my wife and I have an important appointment this afternoon, so I won't be on for the duration of this hearing, but I'll certainly follow up after the fact, and I've got staff on. But suffice it to say, I think some of the issues that I'd love to see addressed is first and foremost thanks to BTD. I know that we're all rowing in the same direction and want the same things, but I would certainly echo the calls made by many of the advocates as it relates to sort of the criteria that allows or that sort of currently dictates prioritization of projects, looking at having more year-round winter projects, particularly as we are still in a pandemic and likely will still be in the pandemic in the months ahead. Certainly the equity lens, which I think everyone has raised thus far, is something that we all want to make sure is done in terms of many of these projects. And certainly looking at ways that we can address connectivity. The last thing that I would just additionally raise, which has been raised by many of the advocates, which I share completely, I don't want us to bite off more than we can chew at this particular hearing, but also looking at some ways around micromobility, and particularly electric assist bikes and scooters. This is something that we've been working. This council played a leadership role with many of you last October. BTD, we were working on a monthly meeting up until really February, when sort of the pandemic put everything on pause. But I think now more than ever, it's important to include this conversation as we think about moving people around the city in safe and accessible ways. So thank you all for your great work. And thank you again, Madam Chair and Councillor Braden, for holding this hearing.
Thank you, Councillor O'Malley. Next up is Council President Kim Janey, but it says on my Zoom that it looks like she's still connecting to audio. Councillor Janey, can you hear us? Okay, I'll send her a message to see if she can maybe sign in and out. And then next up is Councillor Liz Braden.
Thank you, Madam Chair. I'm so delighted to have a follow-up conversation following our initial conversation on safe streets. We have made some progress, but we have still a lot to do. I've heard some concerns out in Alston Brighton that our ability to create widened sidewalks and make little pocket parks or whatever has been a little slow in response, but I'm really interested to hear what folks have to say. I also share Councillor Bach's concern about safe cycling, and I'm very, very distressed to read about the death of a cyclist in Cambridge the other day. It's really imperative that we make cycling a safe option for so many of our folks now who are choosing to use that mode of transit rather than driving, and to share the road safely with other road users. It's sort of imperative that we figure out how to keep it safe. Thank you so much.
Oops, I'm running out of battery. I'll plug in. Next up is Councilor Ricardo Arroyo.
Thank you, Madam Chair. This is probably, for me, you know, I get really excited when we discuss transportation and safe streets. It's been my first term. We're 8 months in the middle of a pandemic, and I can tell you that I just had a conversation with my chief of staff about how many requests we've gotten for speed bumps, and it's over a dozen. And so when we talk about bike safety, when we talk about street safety, when we talk about how we make our roads and sidewalks work for everybody and do the work necessary to really change our infrastructure and the way that it impacts us, we all benefit from that, everybody, universally. And this is the kind of conversation that I'm excited to be having. I'm excited to see where we move forward. And looking forward to hearing from our panelists. And I thank the maker and the chair for what is a very important conversation for the city to be having. So thank you again.
Thank you, Councilor Arroyo. Okay, I do not see Councilor Janey back on yet. I know she's working to resolve the issue with Carrie behind the scenes, and Councilor Mejia will be back at some point too. So why don't we go ahead and we can get councilors' voices back in when they are reconnected. So we'll kick it over to our administration colleagues. I know Vineet, Stephanie, Jacob, and Matt have a lot to share. I just want, if you all could just frame this from the perspective of it being a follow-up hearing. So we want to hear specifically what has happened since we last met on this, and of course, in addition to upcoming plans, but more specifically with the focus on what has been done and kind of how much of what was presented last time can be checked off the list. Vineet?
Thank you, councillors, for inviting the city again, the city administration again, to talk about what we are doing relative to streets in the current pandemic environment. I'm Vineet Gupta. I'm the planning director at the transportation department. I'm joined by Stephanie Seskin, who's our active transportation director, by Matt Moran, who's our transit team director, and of course by Jacob Wessel, who manages all our public realm projects. The way we have structured this very brief kind of discussion or presentation is that I'll give a quick overview and eke out some of the highlights, and then Stephanie and Matt will get into a little bit more detail, if that's okay with the council. And as you mentioned, Councillor Wolf, our focus is going to be on what we have accomplished in the last few months, as well as what we are currently working on in the coming months. So that's kind of how we've structured our conversation. But before we get into that kind of update as background, as all of you know, we essentially focused on, as part of the Healthy Streets program, one on connected bike routes and bicycling related programs, two on increasing or improving reliability of transit, and three, helping small businesses. And we believe that that particular focus gets to looking after the mobility needs of healthcare workers as well as essential personnel, particularly for them to get to well-paying jobs as well as to hospital facilities. We believe that that focus also gets us to helping bus routes that have had enduring ridership, even in this pandemic. Even though subway ridership has gone down, there are many bus routes that have seen enduring ridership. And of course, we believe our focus helps in keeping our small businesses resilient, particularly making sure that they can retain jobs as much as possible. That's been a huge issue in the city. All of this has been done while you see the four of us here at this meeting. As a practical matter, it's been a team effort between the Public Works Department and the Transportation Department. all our divisions, engineering, operations, planning, have been engaged on a daily basis to respond to this critical need of our residents. We have particularly paid attention to the day-to-day maintenance needs that arise from what we are putting in the ground and what we'd like to put in the ground. And that's been a huge criteria for us as well. We can talk later about the criteria that have helped us select the projects that we have done, but let me give a few highlights. Since we last were given the privilege of talking to the City Council, we have installed up to 3 miles of pop-up bike lanes in the downtown area and on Cummins Highway in Mattapan. We have expanded bus stops on the busiest routes throughout the city, particularly on routes that have the most enduring ridership, by giving more space for people waiting to get onto a bus so that they can wait in a safe manner. We have helped over 300 businesses to set up outdoor dining throughout all of Boston's neighborhoods and located 25 curbside spaces for food trucks as well in our neighborhoods. And of course, we've provided hundreds of blue bike passes to hospital workers and to employees of small businesses, including pharmacies. We've done that over 2 to 3 months, and we continue to make sure that all those initiatives are maintained and continue. And as we learn, we can keep improving them. As we move forward, we are currently working on making our pop-up bike lanes in downtown permanent and calming traffic on American Legion Highway through separated bike lanes. We'll be making a major announcement on that particular dimension later on this month, hopefully before Labor Day, but you'll hear more details on that as part of that announcement. We are trying to move forward or continuing the process to move forward on installing bus lanes on Columbus Avenue between Eggleston Square and Jackson Square. We are going to resume the community process for Warren Street as well as for Blue Hill Avenue starting in early September, both for the installation of bus lanes as well as bike lanes. And of course, as you all know, because we talked about it at the last meeting, we are closing in on finishing the community process for North Washington Street for a bus lane heading out to Charlestown, as well as a Washington Street bus lane heading out to Rosendale Square from Forest Hills. So that's kind of a nutshell on what we have accomplished and the direction that we'd like to go. And I'd like to hand it over to Stephanie for a slightly more detailed look at some of the active transportation related projects. Thanks so much.
The active transportation team has really been busy. Early in the pandemic, we heard very strong calls for like 3 sort of categories of things. One, which is just helping people meet their basic daily needs. 2, providing free access to our public bike share. And 3, renewed urgency in addressing safety concerns. So in the first months of the pandemic, General and my team took an active role in organizing food delivery for many Boston residents, and the majority of my team actually was out delivering food 3 times a week for a number of months. Some of them are still delivering food even this week, as most of that has been figured out. We provided free Blue Bikes passes to 915 people who worked in area hospitals. We secured a grant to match our own funds to provide free Blue Bike passes to workers in regional grocery stores and pharmacies, and for those who are working in Boston's like local stores and restaurants. So far, we've provided 350 of those passes. We are, I think, almost done with final design and approval for nearly 40 miles of streets in our neighborhood slow street zones. We also created the plans for the pop-up bike lanes that are in downtown and supported the design and outreach for the trial on Cummins Highway in Mattapan. We also take an active role in
We seem to have lost sound.
Stephanie? Oh. Okay.
Stephanie, we lost audio from you.
Looks like her internet might have frozen for.
Yeah, she's been having problems. I was in a meeting with her yesterday at this time.
Okay, do we want to hop to Jacob or Matt, and we'll circle back as soon as the connection is restored?
Absolutely. And I know from my notes that she does have a number of additional points to make on what we
Yeah, we'll make sure she gets back in. As soon as she is able to sign in, we can make sure she finishes the presentation for sure. But in the meantime, I don't know if Jacob and Matt had additional.
No, I think it's just Matt has to. Matt, please go ahead.
Hey, good afternoon, everyone. As Vinny mentioned, Matt Moran from the Boston Transportation Department's transit team. So just a very brief overview. So our transit system provides a critical link for Bostonians traveling for school, work, and other daily activities. Since the start of the pandemic, buses in particular have demonstrated enduring ridership. This is especially true for key neighborhood links, such as the routes 22, 28, and 111, which have seen a ridership rebound to 70 to 80% of pre-pandemic levels. Social distancing on transit services is critical to helping contain the spread of the virus. Therefore, BTD is partnering with the MBTA to enhance key bus corridors by improving travel times and reliability. The T will be able to run more bus service and thus ensure crowding is less of an issue on these key transit links. BTD recently installed new bus lanes for the Silver Line in Chinatown and downtown, which were also paired with new bike connections as well, and expanded some high ridership bus stops to enable more social distancing. This fall, we're working on several important projects, including, as Vinny alluded to earlier, North Washington Street, the Rosendale outbound bus lane, Columbus Avenue and JP and Roxbury, and additional expanded bus stops to allow for more social distancing when people are waiting for buses or to avoid some conflicts with nearby land uses. Additionally, we are continuing community processes for some key bus lane corridors, including Warren Street, Blue Hill Avenue, Columbus Ave and Tremont Street between Jackson Square and Ruggles. That would essentially be a continuation of the current Columbus Ave bus lane, and Summer Street. So that's a brief overview, but thank you very much for your time. I see Stephanie's back on, so I'll hand it back over to Stephanie.
Yeah, sorry about that. Good rationale for making internet a public utility and not a private company. Yeah, so as I was saying, we're also taking an active role in supporting our operations team and keeping those lanes open and clear. So my team has been out a number of times to move barrels out of the way, to remark where they're supposed to be located, and otherwise just take care of things out there. We also met with some of you in smaller group meetings to talk about potential additions to our bike network in the near term. So over the next few months, as Vinny alluded to, we'll be designing the first phase of Connect Downtown, which will be adding separated bike lanes to most of the network before winter, and continuing to work with residents and institutions to design a better pedestrian experience at many of the intersections where we know we need to do a bit more intensive reconstruction effort. We'll be working with residents and the Franklin Park Action Plan team to plan and design a calmer and safer American Legion with better access to Franklin Park for everyone. That will include separated bike lanes, new crosswalks, curb ramps, better pedestrian timing at the signalized intersections along that 2-mile corridor. We're also continuing to work with MassDOT on building a safe separated bike lane in each direction on Cambridge Street in Alston. We have begun outreach and will be preparing concept plans for 3 new neighborhood slow street zones in Dorchester, Roslindale, and Roxbury. We hope to also be able to be in a place where it's safe for folks to come together to nominate themselves for a prioritization for a 4th round of slow streets. We'll also be finalizing construction documents for our Mass Ave project between Milnia Cass and Columbia Road, and for Tremont Street in the South End, and continuing to provide those free blue bike passes to local workers. So that's the overview for me. I guess back to Vineet.
Thank you, Stephanie, for that summary. Councillors, that's our kind of quick overview and highlights of what we've accomplished, what we are focused on right now. And we really benefited from the discussion that we had with all of you and with other people, including our passionate advocates at the last hearing. And we're all looking forward to having a good, productive dialogue going forward.
Thank you very much, Vineet. Okay, I'm going to go over to our panelists now, and then we'll do Q&A across everyone. But I do want to recognize that Councilor Michael Flaherty has joined us. And let me see if Councilor Janey is back. I don't see her back yet. So, for example, Councilor Flaherty, who did not get a chance to give an opening statement, just raise your blue hand if at some point you need to jump off, and I'll make sure you get the chance to weigh in before then. So in the meantime, great. We have Anna Leslie, Stacey Thompson, Brendan Kearney, Jared Thompson, and Becca Wolfson, representing various organizations across the city. So we'll go in that order. If you could introduce yourself and then give a brief opening statement, then we'll go into questions. Anna?
Sure. Hi. Thanks, everyone. My name is Anna Leslie. I'm the director of the Alston Brighton Health Collaborative. Thanks so much to the councilors for hosting this hearing and opening up further dialogue. From my view, it's increasingly clear that we really need more transparency around this program, the timelines and the objectives. So I'm going to offer perspective at hyper local level in Alston Brighton, and want to share some challenges and some suggestions for how to make the program more effective. So for some background, the Transportation Committee of the Collaborative is a group of neighborhood residents and organizations focused on improving mobility as an essential social determinant of health. We have a track record of great collaborative work with BTD's transit team and BPDA's mobility study team. So I want to be really clear that my frustrations today are not directed at these teams who are consistently responsive and are eager to collaborate with us. So beginning April 3rd, before the Healthy Streets Initiative was created, we've been in conversation with staff, with BTD staff, reviewing neighborhood opportunities to create safer corridors for areas that are more dense, have higher foot traffic, and have more elder residents. In June, when the program was announced, we sent 4 requests to BTD. Since then, we've received repeated deferments and delays, and I just want to talk about a few of those. 2 of our requests focus on improving pedestrian safety and mobility in our 2 Main Streets districts. We've asked for sidewalk expansions into parking spots because there's increased queuing outside of restaurants, decreasing safe passing space on the sidewalk. We've all seen it. Consistent response that we've received is that it's up to individual restaurants and businesses to apply for expanded use permits, which is placing the burden on each business to apply for permits and variances instead of a proactive, systematic approach that allows businesses to safely serve their customers and for pedestrians to safely bypass these exchanges. The current system puts everyone at greater risk as customers and pedestrians are forced into the street to avoid sidewalk queues and bunching. And the variability is also unsafe for cyclists and drivers. We've also been told repeatedly that BTD, Public Works, and the Office of Small Business are consistently talking with and engaging Main Streets directors in this process. So I need to again clearly state, as I have in communication with BTD, that is not the case. To be clear, collaboration with OED is not the same as collaborating with Main Streets. Alston Village Main Streets and Brighton Main Streets directors have not been looped in on these conversations. OED has shared only a process in which businesses can apply for outdoor dining permits, but does not provide any follow-up on what businesses have applied or gotten approved. So Main Streets is not able to do any supportive follow-up. We're not aware of which of the dozen restaurants have been approved. Furthermore, this does not speak to what our requests are. Our request is not about businesses accessing permits for their customers. We're asking that the city temporarily change the use of public space from one that stores cars to one that allows people to safely move. A third request asks for expanded sidewalks on Washington Street from Comm Ave to the Brookline border to allow greater access and safety for elders living at several of the housing developments on Washington. This is a prime opportunity area to pilot and monitor some quick builds. And the response from BTD is that this long corridor requires careful planning and detailed design. Yes, of course, in an ideal time, which is not the time that we live in.
This is great, because I didn't even have to go to the...
So we need to quickly and nimbly respond to resident needs in order to keep them safe. I asked if the team has an alternative plan for ensuring safe movement during the pandemic for the high density of elder residents who live on this corridor, and have not received a response to this question. Again, we are asking for a temporary change of use of public space that prioritizes socially distant pedestrian mobility over free storage of private property. So I think it's clear this is not a community-informed process. During the pandemic, too much is changing too quickly at a hyper-local level for city staff to know everything. And it's essential that they are connecting directly with partners on the ground who can give the hyper-local expertise. And Healthy Streets requires that. This program is in response to something brand new, so it can't rely on old plans and old data and old patterns of movement. But that's the response we have received. What is the precedent for this request? Or is this request is part of a longer process and we'll get to it? Or this project isn't on our list. This is antithetical to the objectives of this initiative, and it makes me uncertain that this initiative was ever intended to be successful. I'm asking BTD leadership and the Chief of Streets to acknowledge that their objectives are not meeting their actions and change their actions to meet their objectives. That means changing resource allocation so that their staff have what they need to partner with stakeholders and deliver on requests. We have repeatedly offered to host planning meetings and walkthroughs to collaboratively design safe streets installations. We've offered our time and our resources to manage and monitor the installations and their use. And there's precedent for this. Alston Brighton was part of the first parking day in the city of Boston, and residents effectively managed the spot on Brighton and Harvard Ave. So BTD staff acknowledge the backlog and requests, and I really commend their team members who are working long hours and doing more with less. And I appreciate that resources are tight. I'm asking for transparency, and I'm asking that senior leadership step up and support what our communities are asking for out of our public space. That's what I have. Thank you so much.
Thank you so much, Anna. Again, we have 4 panelists left. Then we will do Q&A and then go to public testimony. I want to note that several colleagues have joined us in the meantime. Councilor President Janey, I believe, is back now. And as noted before, Councilor Flaherty, as well as Councilor Lydia Edwards. So a note to Madam President and Councilor Edwards as well. We're kind of rushing through to make sure we get everyone in, but if you need to go at any point, feel free to raise your blue hand. I'll make sure councilors who didn't get to give an opening statement have the chance to do so at any point if you need to leave. And so this way we'll just kind of be most efficient with everyone's time. Great. Okay, next up, thank you, Anna. Next up is Stacey Thompson. Stacey will be followed by Brendan, then Jared, then Becca.
Great. Thank you, Councilor Wu. Thank you to all the councilors who are here today and BTD staff. And I would just echo what Anna said. You know, the folks who are here today are really the ones like literally doing the grunt work to make this happen. And so none of my comments are directed toward the Rockstar team. And I want to say I'm sorry you're spending 2 hours with us when I know it probably means 2 hours of additional work tonight at home. So I want to acknowledge that and say thank you to all of you. And then, you know, also say I am disappointed that neither Commissioner Rooney nor Chief Oskett are here even for a few minutes. And we did send all of the councilors a letter that advocates sent to them, you know, nearly 2 months ago outlining our concerns, most of which have not been addressed. So I'm going to briefly go through some of that today. And I would also say that we do have street ambassadors who have been on the ground advocating for some of these you know, needed changes in a pandemic. So there is an urgency and is a need. And I just want to acknowledge those great folks who are tuning into a city council hearing for the first time today. So thanks, street ambassadors. But yes, you know, on May 12th, BTD presented a plan at a city council hearing about adapting streets around COVID-19 response. And we were initially very excited and we have been very supportive. You know, I think the bike infrastructure downtown is as desperately needed as we discussed, and it's like a large feat that we got that done. However, several months in, it's clear that the program isn't fully meeting the intentions described as in that initial BTD presentation. The most glaring issue with the Healthy Streets Plan is that the lack of investment made in Black and brown neighborhoods that have been disproportionately suffering the impacts of COVID. And we know this, right? This was supposed to be the intention of this project. As early as April, my team and other advocacy organizations reached out to BTD with specific recommendations for tactical interventions in the most impacted communities. These recommendations came from outreach we did directly to community leaders and individuals in Mattapan, Hyde Park, Roxbury, and Dorchester. Almost none of these recommendations have been implemented to date. And like I said, that does not preclude how great the things are that are here. And, but I'm going to talk about Cummings as an example. The Cumming Highway Tactical Intervention is wonderful. It is desperately needed. But that only came after a person died. That was not part of the first phase, the first phase. And so, folks were really impacted in that community. And there are lots of folks on the ground. There are folks on the call today who are still doing street ambassador work who want to see that project extended. And I know that it's going to be completed. And at the same time, advocates have been frustrated that while we hear and see that staff are really overwhelmed, other projects like the $100 million Northern Avenue Bridge project is aggressively being moved forward. This is a project that is still contentious, that doesn't have a lot of community support, unless it's for the groups that are going to run private shuttles across it. Why are we having public meetings for a large project in a community when we could be, reallocating those resources much differently in communities that really need it? This isn't a Healthy Streets problem. This isn't a COVID problem. This is a consistent problem that I know you've heard from us over and over again about priorities and process within the city of Boston. We're seeing similarly lopsided and confusing prioritization with other projects. As mentioned earlier, Warren Street, has already had a very robust community-driven process. My understanding, based on our conversations with BTD and the MBT directly, is that project is basically ready to go. And the design includes better accommodations for people walking, biking, and taking bus, but we haven't seen any movement on that project basically in the last 6 months. At the same time, the project on Columbus Ave has been fast-tracked as quickly as possible. BTD knows this. We've had several conversations beginning in November of 2019. This has all been outlined and sent directly to the team and the counselors who are impacted. Bikes were cut out of this conversation, and the direct stakeholders who are impacted by this project who ride bikes were not even met with or consulted for the first time until after BTD announced that it had made a decision there would be no bike infrastructure and they were going to construction. And just, to compare that to Hyde Park Ave, that corridor had its first open house before the Columbus Avenue project had its first open house. That too is an important corridor for buses, for Vision Zero interventions, but there is no plan, there's no clarity around when or how any of those things are going to happen. So why is one project that, many people in the community have been clear, our voice hasn't been heard, we have concerns, please stop, please slow down, still moving forward, and another project, has had an open house and the community saying, please move faster, do more, I think what I'm trying to say here is there isn't clarity around process. There isn't clarity around decision making. And that is something, not to just keep complaining, that is something that can be solved. I think it's very simple. BTD needs to provide a clear plan for what projects it intends to complete before the end of the year and which projects it's prioritizing for spring 2021. We also want to see a public set of criteria for how the city is prioritizing equity and a definition for what that means in order to move projects forward. And that might mean slowing some projects down and speeding some projects up, but what is the criteria being used and is that publicly available? And BTD also needs to have a plan for assessing the success of some of these tactical interventions. We know we want to make a lot of them permanent, and we'd like to understand what success looks like, how these will be changed, so that people feel like they have a seat at the table. And my understanding is that through our Go Boston 2030 assessment process, the city already has a prioritization matrix, but we haven't seen that publicly. So where is that matrix? How are projects being prioritized? And can we get that out in the public sphere so that folks know what's going on and that we can move some of these really important projects forward? Thank you for the time, and I look forward to continuing the conversation.
Thank you, Stacey. I want to recognize in the meantime that Councilor Mejia is back on and Councilor Sapi George as well. So again, to colleagues, feel free to raise your blue hand at some point if you need to jump off, but we have 3 more panelists left and then we'll do Q&A. Brendan?
Hi, yeah, this is Brendan Carney, Deputy Director of Walk Boston. If possible, I'd actually like to give my spot to Walk Boston board member and JP resident Carol Steinberg, who's in the attendee list right now, because we wanted her to be a panelist.
Perfect.
Great.
Okay, we can do that. And then as we're getting that set, I see Council President Janey would like to make a statement anyway. So
great,
Madam
thanks.
President.
Thank you so much. Can you hear me okay?
Yes, we can.
Yeah, so for the first 45 minutes of the hearing, I was having difficulty and got that resolved. Unfortunately, I have another commitment. I just want to go on the record saying that this is an important conversation. I want to thank the administration for all of your work. I know how closely you've worked with me in District 7. We have a very old city and the infrastructure was built mostly for cars. So I appreciate all the work that the advocates are doing in this space and look forward to continuing to lend my voice and strong advocacy on these issues when it comes to equitable transportation and how we move about this city. I will make time to review the tape. I will listen for as long as I can and review the tape for what I missed and look forward to following up on next steps. Thank you, Madam Chair, and thank you for your leadership.
Thank you. Okay, I think we have Carol set. Carol, are you there?
I'm here.
Okay, great. The floor is yours for a brief panelist statement.
Okay, I'm speaking as a member of the Walk Boston board, as a wheelchair user, and I was also on the Architectural Access Board, the State Architectural Access Board for 9 years, so I'm wearing those hats. And I'm as a JP resident next to you, and I'm talking particularly about outdoor dining in particular. And I know, the AAB regulations require that all dining be accessible. And I know that the mayor's initiative was meant to streamline the permitting process so that people could have outdoor dining. I'm totally behind that. I love outdoor dining. And I've had a lot of great experiences. But there's one place, and I guess I won't name it, in my neighborhood, across from the Forest Hills station, where the indoor is totally accessible. It's great. But they have somehow put their tables on this patio on the outside that is like 6-inch steps all the way around. And I called them actually yesterday in preparation for this hearing to see if they had a portable ramp, because I know that was part of the initiative that Kristen McCosh of the Mayor's Commission was very involved in. And they said, no, I'm sorry, we don't have them. And I said, well, do you know that you can get them for free from the mayor's office? He said, I don't know, we'll look into that. Will he? I don't know. So I guess that brings up the whole thing is, why was this approved? So in this streamlining, this was overlooked, and so I wonder how many times that has happened across the city. If they submitted their plan, even in the streamlined process, it should never have gotten a permit from the Inspectional Services Department, especially without a portable ramp. But anyway, so I guess you get my point. On the other hand, there is a tiny restaurant that, they have one table in the street, and they have a ramp. In Mexican restaurant in my neighborhood, they have a ramp, and it's set up all the time, and I so appreciate that, because one table. Anyway, so that's really what I want to raise is, how was the process, the streamlining, working? Is it too streamlined? Would be good.
Thank you very much, Carol. Thank you for sharing that and doing so much of the follow-up work on your end, going between all the different offices. Next up is Jared Johnson.
Okay. Thank you. Hello. Where are my notes? There we go. So hi, I'm Jared Johnson. I'm the Director of Transit Matters. We're also members of the Vision Zero Coalition. First of all, I want to say thank you to Councilors Wu and Breeden for hosting this hearing and to your fellow councilors and then also to members of the administration. So thanks for the opportunity to provide comments on this, and I support the points that were made by our partners in advocacy about a clear plan for what's to be completed, a plan for how we're equitably prioritizing projects, and a plan for evaluation of how we're going to make things permanent. But I also want to make sure that we're not missing a major point here, and that is that we have a traffic and a street violence problem, we have a climate and air quality crisis, and of course we also have an affordable housing crisis. But at times it looks like you wouldn't know that from our development process, and certainly from our approach to parking. And thank you, Anna, for the comments you made around the changes there in Austin-Brighton area. This city is addicted to parking. There's one thing that's most closely associated with increasing traffic in our neighborhoods, and it's parking. Parking is the issue here. On many corridors, there's not enough room for all the street users, and nearly every time, parking wins, and cyclists, pedestrians, and transit riders lose, and sometimes they pay in life and limb. I know it's going to be difficult to cut parking in some neighborhoods, and often the main critique for cutting parking is that transit is slow and unreliable, and that sidewalks and bike lanes feel unsafe. Well, parking is a barrier to both. An ever-increasing number of cars, enabled by ample parking hurts our air quality, and this is especially sad in light of the link between air quality and particulate matter and COVID. And the solution is not more cars, but make them electric. All we do with that is outsource our carbon emissions to poor countries around the globe, not to mention that electric vehicles still produce particulate matter from tires and from brakes, and they also might be more dangerous to pedestrians and cyclists since they're quiet. We also raise the cost of housing and lose homes, even for homeless people, because of our addiction to parking. I'm excited to see the hearing order for zoning relief for deeply affordable projects. Parking has to be a part of that. I appreciate that the council has talked about parking in the past, but we don't need another hearing. We need a plan, and we need a plan that has a predetermined outcome. Less parking. We can work to respond to real concerns from business owners, residents with mobility challenges or other special cases, but we need less parking in new buildings, and less parking overall. By that, I mean, just to be clear, a reduction in the amount of parking spaces that this city has. We need parking reform yesterday. So councilors, I would love to see your leadership in ensuring that life-saving streetscape changes, public space enabled by COVID, and much needed affordable housing and middle-income housing is not stymied by our addiction to parking. There cannot be an equitable vision for a future of transportation in Boston for 2030 or a green justice movement without less parking. We have to break our addiction to parking and start putting people first. Thank you.
Thank you, Jared. And then last but certainly not least, out of our panelists, Becca Wolfson.
Great. Thank you so much. I'm Becca Wolfson. I'm Executive Director of the Boston Cyclists Union. We're also a core member of the Vision Zero Coalition. Thank you, Councilor Wu and Breeden, for sponsoring this, and all of the councilors and BTD staff for being here today. First, I do want to commend the city for the projects they've put on the ground so far. As Vineet and Stephanie mentioned, they've implemented more than 3 miles of protected bike lanes. We're very glad the focus on infrastructure has been separated infrastructure and not shared streets. That's something that most of the cities in the country have been focusing on shared streets, and Boston is really leading in this respect, so that's great. But as folks before me have said, we're just looking for more. We're looking for connectivity so that we don't have this concentrated network in downtown without safe ways to get to and from it. And we're looking for equity in where the streets are placed. While there is this great downtown network and there is Cummins, there aren't connections for safe biking in between neighborhoods, especially neighborhoods of color, and connectivity to that downtown network. One other concern that we have is the lack of a plan for winter clearance. When the network went in a little bit more than a month ago, the word from BTD was, we don't think this is going to stay out through winter. Again, was pleased to hear Vineet and Stephanie say they are looking at what can be made permanent before winter, and we hope that all of it will be able to be maintained through winter. It's a shame to say we have these safe streets for COVID, but can't keep them out through the winter when we know that COVID will persist. We also know, due to facts and figures and data that we've collected throughout the years, already pre-pandemic in normal conditions, more than 40% of warmer weather riders continue to ride in the winter weather. People think that it's a fringe number, but it's really almost, a majority. And we also know, we think that transit is safe, no matter what the media and public perception is, but we know that people will still fear being in enclosed transit vehicles. That's been a major push for people to start biking. And so it's critically important, especially for new riders who've never ridden on city streets before, let alone in city streets in winter, that we provide safe spaces for them to continue to ride. Blue Bikes published data that in the month of May in 2020, as opposed to May 2019, there were 39% of riders were new in the month of May versus 23% last year. That's a year-over-year increase. And again, we know those numbers are going to keep rising. We've been canvassing people on the downtown network and talking to them about their use. Many of them have been saying they're new riders. So again, and loving the infrastructure. Not enough people actually know what the barrels and cones are for. So we've been doing some assistance in educating people. If the city had, more capacity, I know they're very capacity constrained right now. Getting people out to do that outreach is a critical piece. We're happy to be partners in that work. As I said, network connectivity is really important. We can't, just have a downtown network that's a bridge to nowhere. One critical connection point that we're concerned about is getting people to and from MGH, which is an essential place for people seeking medical care, for essential medical workers, people getting to jobs in Cambridge from all over Boston. And while the network gets people to downtown, there's nothing to get folks across and to the Longfellow Bridge, which has critical network, and to MGH. So, what the city's missing connected to the downtown network is also a connection on Charles Street or Cambridge Street, and we're really looking for that. Many folks, mentioned the tragedy of the fatal crash in Cambridge on Mass Ave and Harvard Square on Tuesday. What we saw there also happened on Mass Ave in Boston in April. We suffered a very similar fatality in Boston at Mass Ave and Harrison. An individual was killed while riding their bike at the intersection by a large truck, which is the same situation that happened in Cambridge. Also, what many people didn't see was the day before the fatal crash in Cambridge, there was a crash on Mass Ave South, just south of Melnikas Boulevard, where an individual riding a blue bike was hit by a large tractor trailer. The reports say that only minor injuries were sustained, but we all know that 5 seconds difference could have meant that crash was fatal. We are deeply concerned that the Mass Ave South project isn't going to be going forward until the spring. Another winter with unsafe infrastructure on that corridor for biking and walking and taking a bus is a hazard. And, it's a shame that we don't see projects move forward with enough urgency until after someone has died. We're very happy with the process that the city ran, with the design. It's going to be an incredible boon for all residents. We just really wish that went in before next year's construction season. I think I've probably said enough. The two quick things I just want to mention. I want to give a shout out to Councilor Edwards for her proposal to have a blue line train for bikes. That's also critically important. We're really grateful for your leadership on that and would love to partner. We do free bike repair in neighborhoods at farmers markets throughout the summer. Through the end of August, we'll be doing bike repair every week at the East Boston Farmers Market. People flock to that market because there are no bike shops in East Boston, and it's really hard to take your bike on the train to get it repaired because of the crowding and lack of access. So it would be critically important, great to get access on the Blue Line train. So thank you for that. And one more thing I'll say to Anna Leslie's point about resource allocation, BTD, I forget who mentioned at the beginning that their team has been spending time delivering food. That's also a critical service for residents who need access to food, but maybe it would be better served to hire some part-time folks, give them jobs, let them deliver food, and let the specialized BTD transportation team do what we really need them to do in advancing healthy streets. So thank you for giving me the time to speak.
Thank you, Becca, and thank you to all of our panelists. So we'll go to Q&A now. I know several colleagues said they had a 2 p.m. meeting that they will try to come back on for. So I think we have lost Councilor Flynn from that. Okay, we'll go to the co-sponsor first for questions. I'll save mine until the end. So we'll start with Councilor Liz Braden.
Thank you, Madam Chair. In terms of, I want to drill down on the issue in Alston Brighton. If Anna Leslie is still on the call, have we had any implementation of any of the suggestions in Alston Brighton so far? Is Anna still here?
You want me to answer that? Or?
Yes, if you're in a position to answer the question, I know you've been surveying this with your transportation committee.
Sure.
So.
Yeah, so we have 4 requests, and the one I think that where we've seen some traction is dedicated bike bus lane along Western Ave, and so hopefully integrating that into the larger Western Ave corridor and rezoning project. And so the indication that we got was that that could be the soonest that could be addressed was later in the summer, which I guess is now. So looking for that any minute. I'd say the other requests. No. Is my answer on that.
Okay. In terms of, I know you've been thinking about, as time has gone forward, are there other requests that if you were doing it again, that you would make a different request at this point in time?
That's a good question. I think, you know, we're continually looking at, again, how are people moving during this time and where's their tightness in corridors. Now knowing, for example, with MBTA and their increased service on the 66 and the 57. So we'll hopefully be seeing more ridership on those routes along Brighton Ave. But we've got a dedicated bus bike lane there, which is fantastic. So I think also making sure that that space continues to be used effectively. We know with Cambridge Street, hoping for dedicated bike bus lane next year. And we haven't heard quite the urgency there around need for space. It really is in our Main Streets districts. And I would say particularly with students coming back, in our Main Streets districts, this is only going to get worse in terms of pressure points, where there's crowding, where there's tightness in people using sidewalk space. I'd say, and also, I am really concerned about the Washington Street corridor. There's a Whole Foods there. There are 3 senior housing developments there, and BC is quarantining any of their COVID positive students 200 feet away. I can't think of a better place to have more social distancing.
I agree. Thank you. The other bus line that I've heard some reports about was the one from Brighton Centre to the Longwood Medical Area. I think it's the 65. Because it's going to the medical area, a lot of workers use it to get to work, but it doesn't run. It's on an early schedule on Saturdays, and it doesn't run at all on Sundays. So I've heard some concerns about that as well. And it goes past that area of Washington, goes down Washington Street, where again we're asking for some more safe pedestrian access. Thank you. That's all my questions for you. Thank you. Thank you, Madam Chair.
Thank you, Councilor Braden. I will insert with Chair's privilege here just to offer Vineet and the BTD a chance to speak directly on what Councilor Braden just asked as well, just so Anna gets her answer too while we're on the topic.
Sure, happy to do that. Constable, I'm assuming that we'll have a chance to talk to some of the issues that were raised by the other panelists later on in the conversation. Great. Absolutely, we want to build on our success of installing bus lanes in Alston Brighton that we did last year and earlier this year. We have had a chance, actually, as recently as yesterday, to meet with our colleagues at the Boston Planning and Development Authority to particularly look at doing something for Washington Street. I know that in extensive email exchanges I've had with Anna over the last 2 months, Anna. So we are trying to do as much as we possibly can to get to Austin Brighton. I think everybody in the room or in this virtual room understands that we get dozens and dozens and dozens of requests every week, and we are working day and night practically. But I've been trying to get to Austin Brighton as much as we can. I know that Jacob Wessel, you were in a meeting last night with the Austin Brighton Main Street group, correct?
With Brighton Main Streets, yes.
Brighton Main Street. So we're trying to do a pop-up public space at Brighton Center this year. So I'll be the first to say that we haven't done all that you would like us to do in Austin Brighton, but we are trying to get to as many things as we possibly can. So that's my kind of quick response.
Thank you.
Okay, great. Thank you. Yes, I'll make sure with my Q&A time, Vineet, that I'll leave space to address some of the other issues raised as well. Next up is Councilor Kenzie Bach.
Thank you, Madam Chair. And thank you all again to the advocates and to the BTD team. I guess my first question would be about I think you guys made that reference, this is for BTD to sort of how we transition some of this infrastructure into being permanent. And I would love to hear what you think the process is. I mean, I'm thinking particularly of the bike lanes around the parks, but I just would love to know what that's going to look like. And then I was wondering if we could circle back to the question I raised it, I think, and also the advocates around the possibility of sidewalk expansion at a more systematic level. So those would be my two questions.
Councilor, how do you want to manage?
I mean, well, why don't we jump with the process on sort of making the infrastructure like the bike lanes?
And like Stephanie and I said, we are working towards making the downtown pop-up bike lanes permanent, and we're actively working on it right now, and we will be making a more detailed announcement in a couple of weeks or so, or before Labor Day. But Stephanie, feel free to jump in.
Yeah, I mean, I guess maybe it's helpful to understand that it's like not super easy to just, it's not like street mix where you can just like move things around and then all of a sudden it works. There's quite a lot of work that still has to go into ensuring safety for everyone, while also maintaining a clear separated bike lane and a place that we can sweep and plow during the snow season. So we are spending a lot of time on design work in-house to make sure that that's moving forward as quickly as possible, including coordination with our signals team to answer their issues around capacity needs, safety, managing intersections and turns. I think we'll also need to be beginning a more public campaign to explain how these lanes work and what they, why we're doing them and what the network will be, because I think the lanes that we did are not all of the lanes that we want to do. They don't provide the full connection, and you know, we have tried to advance some of that over the summer and haven't made it very far. So those will need to come in the spring. So there's some process there. And as I mentioned, the very strong and loud need to improve pedestrian experience at all of these signalized intersections does mean more detailed design work that takes time and effort to make sure that we get the grading right, that there aren't going to be large puddles, that we're repairing the sidewalks if we have to. So that's work that we'll continue to do.
Great. Yeah, and I guess, right, and I guess mainly my question is just trying to understand from a timeline perspective, because I appreciate it's a huge amount of work. And I know that like we all had a kind of sense of what the Connect Downtown public engagement process looked like before COVID. And then we've gone ahead and done it a different way, right? In a way that I think has made a lot of sense. And so I'm just trying to understand, like, you know, for the the ones that we have down as temporary, are we on a timeline where we could conceivably get physical things in the ground before the winter or not?
That's the plan, yes. The cones and barrels can't stay for the winter. So we are working very hard to make sure that we get everything lined up to have something else out there that can stay.
Fantastic. And is there anything we're doing to sort of like, in terms of the process and being the pilot, like, is there anything we're doing to gauge how the signals and turns and stuff are working with the temporary setup? What is that feedback?
Yeah, I mean, we have been collecting feedback. I think when I checked yesterday, we had heard from almost 300 people just with our online survey. That doesn't include everyone who's called or emailed. We also do regular observations, as I mentioned before. We have to go and move the barrels on a regular basis. So while we're out there, we also watch how trucks are turning and how people are behaving, particularly in intersections like Beacon and Arlington and Beacon at Charles, where they're used to having more space to make those turns. So we're watching that pretty carefully to understand, how much space they really do need. And how to make sure that when we do add those bike facilities, that it doesn't result in serious injury or fatality from interaction with a large truck and a person on a bike. There's also some challenges around connectivity, especially in a short-term turnaround. So some of the intersections are kind of weird, how they're operating and how they're going to operate for a little while. But we've been watching how people are actually using the infrastructure, what directions they're going, and we will be getting some additional normal traffic data, but of course it's not normal traffic, it's just that we're going to be checking speeds and counts. We do have a sensor that's up at Tremont at Boylston on the corner where the new Guy Fieri restaurant's going to be. That has been tracking movements of peds, people on bikes, trucks, buses, and cars for the last month or so. So that will be helpful in understanding some of the more fine-grained movements, as well as taking account of everyone who's using that intersection.
And do you know, this is a small thing, but one thing I've heard a lot of positive feedback on is the sort of little bump out in the cones that makes the mid-block crossing across Beacon by the public garden shorter. And I was
at Bremer Street, yeah. We're going to make that part of we're going to do as much as we can with these interim materials to make those pedestrian crossings better. The other one that I've noticed as a pedestrian feeling a lot different is walking across Charles Street at Boylston between the garden and the common, which used to be 4 lanes and now is just 2. And it's oh, I'm already done crossing the street. How did that happen? So definitely want to make sure that those pedestrian improvements to the best of our ability can be done in the quick term, but a longer term, that intersection needs to be rebuilt.
Great. And then do any of you have any comments before, I'm sure I'm going to run my time out, just on kind of sidewalk expansion and prospects for that?
Yes, happy to get to that. And I can't help myself but add that another huge kind of structural change that we've done through the downtown network is remove the right turn lane from Tremont going south onto Boylston, and putting in a bike lane on Boylston Street to replace the eastbound travel lane. And we haven't heard any negative feedback so far on that, so that's been a huge success. On the expanded sidewalk front, as I mentioned, we are currently focused on bike lane connectivity and programs, on improving bus reliability, and on helping our small business restaurants remain resilient. And so expanding sidewalks is not currently on our program. We are happy to work with specific communities, such as looking at Washington Street in Austin Brighton, between Com Ave and the Brookline border, and see if there's anything locally we can do. But right now we're not geared up to do expansion of sidewalks in the current program. just thought I'd be kind of clear and transparent about that.
No, and I appreciate that, Vinny, even though I would like to see that be more of a tool in our toolbox, because it's something that I hear from people and that I see people needing around our neighborhoods.
Yeah, but, it has to do with, I think, and this is my own kind of thinking is, and I think if there is a crowding problem on a particular sidewalk, we should definitely investigate. And I think that there are many crosswalks that are wide enough, and there are many crosswalks that are extremely narrow. So absolutely it can be.
Yeah, and I think the question is really like, do we have even a mechanism for that, right? Because right now it's like, if I know that I want expanded patio seating, I mean, I know that there was a point about systematicity, but at least I know, if I want to ask as a restaurant for that, this is what I do. Yeah. There's no mechanism right now to say, hey, here we're really experiencing a sidewalk crowding.
I absolutely agree that it's a need, but we're trying to kind of focus in on the 3 programs that we announced earlier.
Well, I'm sure my time's elapsed. I'll just say I also count me as a strong supporter of that, replacing that right-hand turn down Boylston with the bike lane. I think it's key connectivity, and I actually have heard a few complaints about it, but nonetheless, I'm for it. So
I have to, but I didn't want to spoil the mood.
So, anyways, all right. Thank you so much. Thank you, Madam Chair.
Thank you, Councillor Bach. I see a hand raised from Carol. Did you have a response to Councillor Bach's question as well? Okay, so we'll do Carol and then on to Councillor Arroyo, Councillor Edwards, and then Councillor Mejia for questions.
Before I begin, Madam Chair, I know some people have time commitments.
Sorry, Councillor Arroyo. Councillor Arroyo, wait 1 second. I want to make sure that Carol gets a chance to just quickly get her response.
I don't think I'm directly addressing Councillor Bach's issue, so.
Okay, great. I will make sure that in my question time, I'll hand it over for any panelists who want to respond to anything beforehand. Okay, so we'll go on to Councillor Arroyo, Edwards, then Mejia.
Thank you, Madam Chair. And I just wanted to say that I understand some of my colleagues have time constraints. If any of them would prefer to go right now and raise a blue hand, I'm happy to give them my time. I'm going to be here for the entirety of it, so it doesn't impact me. I don't know if I see any hands, so I'm happy to go. So my question is, at the moment, the Cummins Highway, it was brought up that was brought upon because we lost a life there. And that stretch has been a hot spot. I mean, I've been in office for 8 months. It's come up multiple times. It's one of my staffers used to bike that route, so I'm very aware that it's a dangerous route. And so when we talk about the moves that we're making right now with Safe Streets, I guess for me, what I want to make sure of is what is the permanence of these moves? Are these temporary in an expansion that's happening right now, or are these moves that are going to be permanent? Are we going to see protected bike lanes on Cummins in these areas? Are we essentially testing these areas out for permanent changes?
Our intent is to make them permanent, but as Stephanie was explaining, we don't want to rush into it. We just want to make sure that that the quality of design and the focus on safety is done properly and professionally and hand in hand with the community. And so any location where you see a pop-up lane is in an area where we've always looked at permanent facilities as well. In many instances, they serve also as a trial, and we can see how that goes.
I can speak a little bit to Cummins. So the timing of the temporary materials perhaps implied that we were responding to a fatality. I know that the Public Works team has been working very closely with residents there for over a year on rethinking what Cummins should look like in the long term, and had already developed these plans even before the coronavirus pandemic hit, with the intention of being able to do them as a trial to help the community members envision what it could look like, and to better understand the impacts on traffic, which was a big concern that people had. So that is the purpose, and we are doing a lot of data collection, observations, and otherwise like listening to community members about what is going on with this trial to help inform what the reconstruction project will look like.
Thank you, Stephanie.
Thank you. I appreciate. Sorry, did I cut you off? Were you going to answer?
No, but go ahead, Councilor.
Thank you so much. I know we mentioned Hyde Park Ave. I've been big on advocating for Hyde Park Ave because, frankly, it's a stretch of road that in my entire life has really never been redeveloped from an infrastructure standpoint. They did at one point sort of modernize the lighting in the middle lanes, and they sort of beautified it a little bit, but they've never actually structurally changed the traffic flow or any of the things that we could do to create bike lanes or do any of that. I know that the Hyde Park Ave project is sort of future scheduled, though I'm not entirely satisfied with the answers I've gotten in terms of the funding and where and how we're going to do that. What do we have scheduled still that hasn't been executed as far as the safe streets in my district specifically, Hyde Park, Mattapan, and Rosendale, that hasn't already gone up, if anything?
Thank you, Councillor. And as I said, we'll be looking to make an announcement about the next phase in the coming weeks. But in addition to Cummins Highway, we've also, and I don't think these fall in your district directly, but we are starting early September, restarting our community process for both Warren Street and Blue Hill Avenue. So it will get to Mattapan Square. And we've made some improvements in Mattapan Square already. And so we'll continue the discussion in that part of the city.
So is it safe to say that right now there's nothing scheduled or planned for River Street in terms of Hyde Park running all the way up to Mattapan Square, or for Hyde Park Ave at the moment? Not for 2020, correct? Okay. I think that's it for my questions now. I'm happy to see the floor so that the advocates have more time to speak and we have more time for questions.
I should mention that I know the Rosendale Square probably falls in your district, Councillor. So the outbound lane from the bus lane from...
That's the Washington bus lane, right?
Yep, so that's going to happen.
Okay. And what's the timeline? I think that got moved because of COVID.
Yeah, it got moved because of COVID. We finished the public... Matt actually wanted to jump in. I'm trying...
Hey, Councillor. Yeah, so as Vineet mentioned, we're done mostly with the public process for the Rosendale outbound lane, and we're looking to finalize design and hopefully implement in the early fall. So once we have a better schedule with the design and sort of what that looks like, we'll be able to report back to you with the exact timeline.
Thank you so much.
Thank you, Councilor Arroyo. Next up is Councilor Edwards.
Yeah, thank you for this, I think, incredibly important conversation. I want to echo the comments from one of the advocates about this is about planning as well, and seeing the bigger picture of how our city is supposed to move, honestly. I've been a stalwart supporter of affirmatively furthering fair housing, that amendment to our zoning code. I think transportation and access to opportunity is one of the standards that we need to also analyze when we talk about equity in the city of Boston. And so just reminding people that, as we're pushing for and we're standing up for equity, whether someone has a 20-minute commute to their job or a 2-hour one, or whether they're losing 2 weeks of their life on a bus, that has everything to do with planning as well. And I look forward to a commitment from the city of Boston around equity and assuring that everyone has access to public transportation, to their jobs, and also honestly making sure that we are not continually to favor the commutes of suburbanites coming into the city of Boston at the cost of the lungs and the health of many of our communities of color, which we see in East Boston, we saw with Chinatown. So I just want to be very clear that that's the kind of lens that I'm looking at this through. In this time, I'd love to hear also from the cities their thoughts and commitments to two things that I've proposed. The pre-tax benefits, we had a hearing about that specifically on showing that we are actually pushing for and incentivizing people to commute and use public transportation. And then also the Blue Line, having a car dedicated to folks, to bikes on the Blue Line. Myself and Councilor Wu filed for that hearing order. I would love to know that the city would be a partnership in advocating for that to the MBTA. I want to acknowledge areas where the city has been doing good in my district. The East Boston Task Force, however, needs to get going. I know that's part of Plan East Boston, and I appreciate that, but we have a task force for transportation and parking, and I'd like to see that the neighborhood conversation is starting in earnest, and that that we will see, the results of that conversation. I want to acknowledge the work from Eric Prentice and sidewalks in the North End and in Charlestown, and dealing with the brick sidewalks and access for folks with disabilities and wheelchairs. There has been significant work there, but again, hearing from my colleagues in other neighborhoods, we want to make sure that not just the downtown historically preserved, beautiful sidewalks are taken care of, but everyone and everywhere feels that there's access to safe sidewalks. But I do thank you for that hard work in the North End. And finally, I guess I wanted to make sure that we were also discussing the safety on Bennington Street in East Boston. It has been a speedway for some time. There's pictures of ridiculous crashes, and I would still push for slowing down the streets and making sure we had more flashing lights and safety measures guided by the community in East Boston. One more thing, actually, Benit, discussing the pre-tax benefits, you brought up the very good program that the city is doing, requiring developers in their TAPA agreements to pay for, not just encourage them, but to pay for the new developers or their tenants, if they're employers especially, to pay for their employees' public transportation. I am curious, for those TAPA agreements, is there a circle of community advocates that also sit there with you to help also negotiate and maximize more benefits from developers if they're coming in there? I think it's great that you're sitting down there and pushing developers to do more. I'm curious who in the community is sitting with you to also make sure that it's an equitable, part of a larger vision and understanding of how we pushing more and more people to use public transportation. So 3 major buckets. Again, I'll just say I'd love to hear the city's thoughts on the pre-tax benefits. We had a hearing about that. I still firmly think it's something that we should be doing to incentivize people. 2, I'd love to hear the city's, I'd love to have a commitment from the city to advocate for and support a line on the blue line, or car on the blue line dedicated to bikes. Again, we're the only neighborhood, East Boston, that cannot bike into downtown. And I have tried it. I did try it. I wanted to say, where is she? Stacey, I tried it. And let me tell you something. When you go back behind in the industrial area of Chelsea, the trucks aim for you when you're on a bike. And then you cross into Everett, which is right before the casino. You've seen those lines. And then you make a left turn onto the Alfred Street Bridge, and then you go into Sullivan Square. That's how you would have to bike into the city of Boston right now. That is frighteningly dangerous. And so I'd love to know that the city supports at least the state being a partner. And then again, finally, I'd love to hear again about your community process and involving advocates in the TAPA agreements when new buildings are coming up and you're pushing for those developers to do more.
Sure, I'm happy to talk about these one by one. First, the pre-tax benefit piece. We want to make sure that we can get out to the neighborhoods as much as to big developers downtown and big developments downtown and big employers downtown. And so, and I think we mentioned this at the last hearing, is that we have a program to offer free T-passes and free blue bike passes that we'll be launching in the coming months. We are for selected Main Street District small businesses. So that's made some progress. Actually, early next week, we are doing a meeting with the Main Streets director to figure out exactly how to target that subsidy so that people who don't already have a pass are kind of taking advantage of it. We just want to make sure that it gets to the right people and results in giving them the benefit of getting to the T. So that's one piece.
That's wonderful. So, great. Are the advocates in that room too with you to help you define where and what communities and what forms of community benefits make the most sense?
It's really through the Main Streets districts that we're doing that, to the Main Streets team.
I think it's great. Again, I would encourage you. I think what I heard from some of the advocates is that they want nothing more than to be there to amplify these.
No, we're happy to include, I'm assuming you mean Transit Matters and the Boston Cyclists Union and the Liberal Streets groups?
All these wonderful people here today, and people in the community, like people who aren't part of a formal organization either.
Understood.
You know?
Understood.
Okay.
Yeah. So I will try and kind of improve. I'll use the word improve our outreach efforts in that case.
Yeah. Thank you.
The second piece, a blue bikes car, absolutely. We can definitely kind of campaign with the T. I don't know if Matt or Stephanie, if you wanted to add to that particular point.
The big blue car has been a community idea for quite some time. Obviously, I think the city would be supportive of having that and to have it on more trains to enable commuting during peak period when you normally wouldn't be allowed to bring a bike on the train. Yeah, we would love that.
The third piece has to do with, sorry, Matt, I cut you off. Did you want to add something? Or you good?
I was going to second what Stephanie said, so go ahead.
The third piece has to do with our tapas. And we have actually, particularly, we are reorganizing how we do our tapas completely. And we are going to, with the focus on having a system where transportation demand management initiatives, such as making things mandatory as opposed to encouraging things. That's a system that's going to kick in, and San Francisco has done this really well with a points-based system. And we hired a consultant maybe a month ago who is working with Allah Muqahal, who is our TDM manager. She's doing a fantastic job. And so we'll be announcing that. I just want to make sure that it's thought through, all the T's are crossed and I's dotted before we announce it. So I'm not going to say when we're going to announce it, but it's in progress for sure.
Yes, and again, for those who don't understand or aren't familiar, these are the transportation mitigation agreements with new developments. They're bringing in, especially those with commercial parts of their portfolio or the building, the city is maximizing as much as possible for transportation benefits. And I'm hoping, that along with encouraging commutes, we don't want those benefits to also just be fixing up streets for more cars, right? It's really pushing for them to pay for and get their tenants and their tenants' workers off of the streets and onto public transportation or building, infrastructure for bikes. So again, I think it would be great to get some more advocates in there instead of rolling out a fully baked plan saying this is what we're going to do. The point systems, the perspectives, all of that could be really informed. Again, this is a matter of amplification and getting so many people. I don't know anyone who disagrees with this, maximizing this stuff, but just making sure we amplify as much as possible to get everybody's buy-in.
We are happy to expand the network of advocates we are working with. We are currently working with all the transportation management associations to help us craft this, but I'll take your guidance and expand the network of people we're talking with.
So I'm going to conclude by saying I wanted to acknowledge also another accident that happened in my district. He was actually running. And I want to thank God he's well, but he was running and turned and was hit full on with major head injuries, one of my constituents in Charlestown. And so just to acknowledge and wish him and his family well. He is sitting up now. We did not know what he was going to be doing, and we're going to be wishing him immense, but it was a split second, went out for his normal jog, turned on the street, and he was laid out. So again, it's not just bikers too and trucks. We're talking about really an infrastructure that encourages people to be moving physically out of their cars also on our streets. And we need to be seeing that holistic vision. So we wish you well, Howard. That's all.
Thank you, Councilor Edwards. I see a few hands up from panelists. I'm going to go to Councilor Mejia to get her questions in because I know she has a time constraint. So it might be that you would respond to her questions anyway. And if it's not related, you can use my time afterwards to get your responses in terms of panelists. Okay, Councilor Mejia.
Yes, thank you. Thank you so much. Thank you to the sponsors for hosting this and to you, Madam Chair, for your relentless advocacy in the space, and to the administration for all your work. So first of all, I have a really bad internet situation here. So if I go off, I just will have to come back, and hopefully I still have my time left. But every time I walk into a room, I always look to see who's here and who's not. And I think that when we're talking about livable streets and we're talking about, planning and development and all of these things, I always think that those who are living the realities and doing the work oftentimes are the least engaged in these conversations. And more particularly, I think people, low-income and low-income communities and people of color are not as engaged in this conversation. And I'm going to ask the administration and all the advocates here that we need to start working on making sure that people in Dorchester, Roxbury, and Mattapan understand how important these conversations are to their quality of life, and that we start improving their participation and engagement in this, because it's really hard to convince people about changing up the streets if they don't feel like they have a stake in it or they don't understand what the connection is. And oftentimes when we think about safety and pedestrian safety and just quality of life issues, we're thinking more about the bullets that we're dodging every day in the neighborhoods. We're not really seeing all of this through a planning and development and, livable streets type of environment. And if we want people to feel safe riding their bikes, then we also need to have this conversation from an interconnected lens and recognizing that those things are real. There are kids who can't even ride their bikes in their neighborhoods because they just don't feel safe doing so. And I think that it's really important for us to acknowledge that and to also bring that into the space and figure out how can we have this conversation that also brings in public safety into this hemisphere, if you will, so that we can all have the same conversation. So I just want to throw that out there. I'm sure you already have thought about it, but I just got to say it, because if I don't say it, then I'm not being my true authentic self. So all that said, I am curious here of the 2% of the quote unquote very dependent car Bostonians, over half are in the lowest income bracket. And how are we designing safer and more public transit friendly streets, particularly with a poverty lens? And I don't know who could answer that. Michelle, Councilor Wu, can you direct who's that? Who got?
Yeah, let's start with Stacey Thompson. I know Stacey thought a lot, my whole setup's crashing here. Stacey thought a lot about the important issue that you started with, and I think would have insights on your question too.
Yeah, I just want to flag, and I know we are constrained for time, but thank you, Councilor Mejia, for flagging that, because there are actually a bunch of folks waiting to provide public comment who are from Dorchester Bay EDC, from Mattapan Food and Fitness, from the community, who we might just want to give some space to also share their thoughts. There's some of the folks that have been working on some of the corridors that have been brought up. So I do want to flag, I agree with you. I can't answer how the city is doing planning from a poverty lens, but I'm sure that folks from the Vision Zero Coalition would love to sit down with you and talk about that and bring some of the community partners with us. I think that'd be amazing.
Yeah, and can I just make a recommendation that I'm not sure who, it would have been great to have some of those folks who are waiting for public testimony to actually be part of this panel so that they can also lead these conversations, right? Because I think, and this is not being critical of just the process, but if we're really serious about making sure that we're creating space, we have to step to the side and let other people lead. And that requires us being able to do that. And so, I'm not going to be able to stay on until I'll leave and come back and hear some public testimony. But, it would just been nice to have that. So I'm going to go to the city of Boston and I'll direct this whole conversation. What do you guys have to say about this situation? How are you guys doing this through a poverty lens?
So I can, relative to public transportation, we can definitely get into the details, but it started with our citywide plan, Go Boston 2030, where we identified areas which are which have the least or the worst quality of public transit, areas that where people who live there take the longest to get to work or get to where they have to go, whether it's to a community center or to a playground. We identified areas where people of color and people of low income were located, and many of the projects that are listed in Go Boston 2030 try to improve access for precisely those communities. These are projects that we are currently working on. They include trying to improve bus service, for example, on Blue Hill Avenue. They include, for example, and we've had some success with a program that's already in place, increasing service. That was a city-driven advocacy that we asked the T to adopt on the Fairmont line. There are several other public transportation-related initiatives that are focused primarily on these areas that I identified, that we first identified through Go Boston 2030. It's the reason why the transit team was created by the mayor to kind of get to those areas, and Matt Moran and his team have really stepped up to the plate and given us a voice with what the T does. So all credit to their team and the rest of our team, but Matt, feel free to jump in.
Oh, but before you do, Matt, because I definitely want to just kind of like hang in here for just a quick second longer. In terms of the Goal 2030 Boston plan that I need to read, because I haven't read it yet, and that's okay. Michelle is the expert in this area, so I lean to her to advise me. But I'm just curious, like, how many languages were those? You know, in terms of your outreach efforts, how many languages were these community outreach efforts were made in? But just curious about language access. Were they translated in multiple languages?
Yes. The community process was managed by a group called the International Institute of Social Change, and we basically let them run the public process for us, and they have a very high standard of how community process is done, how outreach is done, how jargon is eliminated, etc.
Yeah.
And they didn't actually, if you see behind me, there are posters in 4 languages right behind me that are from Go Boston 2030.
Okay, that's great. Matt, wait 1 second. I'm just gonna, before you go, I just gotta put in a little bit more. Then you should answer these questions. I'm curious also about, you know, one thing is race, the other thing is socioeconomic status, right? And there's a lot of privilege that sometimes people forget, that not everybody knows how to read or write, even in their own native language. So I'm just really curious, Matt, if you can answer this question in terms of the level of engagement and effort that's also being made to ensure that people who have low literacy rates are able to understand and engage and participate in the process as well.
Yes, that's a challenge, absolutely, and something we should definitely improve on.
Yeah. Okay. Matt, I'm here all about voice, and I'm not even letting you speak. So go on ahead and say something real quick.
No, I'll just echo what Vinny was saying. You know, I think equity is a core part of our team's work at the transit team within BTD. You know, focusing corridors where there is, you know, sort of pre-COVID known existing equity challenges and concerns, and then post-COVID or in the sort of more COVID world, looking at sort of that equity lens, but also zip codes that have higher COVID positivity rates to identify which bus corridors we should look to improve. So, for example, as Vineet said, we're looking to restart the public engagement in Warren Street, Blue Hill Avenue in the coming weeks, Columbus Avenue and North Washington Street, both of which serve, you know, communities of color and, you know, communities with equity concerns. And then the Fairmont line, just to echo Vineet, again, we worked with the T to increase service on there by an additional 8 trips a day. And what that did was allowed for, you know, later service in the evening. So people who have later shifts, the last train out used to be 11 p.m. Now it's midnight. The first train used to be 6:30. Now it's 5:15 a.m. So people who have earlier and later job start times are better served, as are some trips for Boston Public School related start and end times. They also now allow you to use a Charlie card on the Fairmount line, which hadn't been done before. So they have Charlie card readers, you can get that validated, and you can use a standard Charlie card pass to get on and off the Fairmount line, and which allows for easier bus transfers. So that's key to making the line a lot more usable for a lot of our residents.
That's great. So I'm gonna go to, just gonna move on. I'm curious in terms of looking at this through a civil rights lens. Everyone needs equitable access to safe transportation. With that in mind, can you go through the process of identifying sidewalks and streets that need to be fixed? How does this coalition or the folks that you're working with, how do they inform that? And who do you work with in the community to determine that?
Yes, so we have, and I know Sue mentioned earlier that we should be sharing those more publicly, but our selection process is driven by specific criteria that includes equity. A good example of that is how we do selection of our neighborhood slow streets program, which if you go to the website has very clear criteria on how we kind of select from the application process that are fundamentally geared towards all the groups that we talk about that are in most need of help to have a safe safe streets and sidewalks around where they live and where they go to. So we're happy to share that in the coming days, but the neighborhood slow streets program and some of our transit investments are good examples of where that criteria is being used.
Yeah, and do you have any data on that tracks where incidences or fatalities happen?
Yes.
Are there certain streets that you have noticed that have a higher percentage of others?
Yeah, if you go to our Vision Zero website,
okay.
Thanks to the fantastic work of Charlotte Fleetwood and others on her team and at EMS particularly, we have a map that shows our what we would call the high crash network.
Yep.
So these are the streets that have the highest, and maybe Stephanie might know this, 6% of, there's a statistics that used nationally. And so you can see that map, yes,
Yep.
all the locations.
The reason why I ask, because I think it could be really helpful in our advocacy out in these streets with folks who are usually not engaged in these conversations, because I'm really thinking about how do we resolve this issue, that this lack of engagement in low-income communities so that they could understand that this is their fight too. Because oftentimes the way I have seen this is that this narrative is that these are people who just want more bikes and they're not thinking about the people who have grown up here. Like it's us versus them, and we need to change that. We need to change that whole entire narrative. This is about all of us, right? And what we need to do is figure out how we're going to have this conversation that brings people into it, understanding that this is just as a concern to them as it is to someone who likes to bike, right? Because there is definitely this point of contention here in Boston when it comes to creating safer streets. And I think that this moment in time presents itself as an opportunity for us to really think outside the box and develop engagement strategies that feel more inclusive, right? And I'm urging the city to really be mindful and thoughtful about your communication rollout, because I do believe there is a disconnect. And the last thing I'll say before I get my little gavel timer situation, for somebody who had to leave, I keep on flapping my lips. So I'll say one more thing, is that I think, the blue bikes are really important, especially now with COVID and all of these issues around remote learning and these like there's kids who sit in empty buses, right? And we're not really looking at the carbon footprint of these buses, right? And I think if the blue bikes, if it can be free right now, I think it's a $50 membership fee for the year, which you think is nothing, but it is something to a lot of people who don't have much. But if we could figure out a way that during COVID, that we can provide bikes to kids so that they can ride to their schools, because now instead of making them walk 1.5 miles, like let's equip them with bikes, and then let's start creating a sense of culture that it's safer to ride your bikes, because we're not gonna all of these issues again go back to safety, and it's the pedestrian and but there's also the public safety concerns here. So I feel like we have an opportunity to seize this moment to create a different type of livable streets for all of us. And I just wanted to say thank you to all of the advocates. I know I wasn't yelling at you all because you were here and the other ones were waiting in the room, but I definitely would like to see more people of diverse persuasions up in here the next time I come back, okay? Michelle, you make that happen. And thank you so
Councilor Mejia. Okay, great. So I see Councilor Braden has a hand up, and I want to give her the chance to weigh in. While she's doing that, I'm going to start letting everyone, shifting everyone over from the waiting room to the main Zoom room. So we'll go to Councilor Braden, and then I know Vineet had wanted to chime in on a few things in response, and then I see Chevelle and Gary and Bikes Not Bombs and so on. So we'll start to kind of shift through public testimony at that point. Councilor Braden?
Thank you, Madam Chair. I also want to thank the folks from BTD for all their hard work. The folks who are here today, as someone said, are they're doing the grunt work and trying to make this happen. So I really appreciate all their efforts. One question I had was, I understand there's a limitation of resources, but in Alston Brighton, the transportation group and other groups in the neighbourhood were very instrumental in doing the groundwork to get our bus lane, our bike bus lane down Brighton Ave. They did a lot of the surveys and talked to the shops and the ridership, and they did a lot, and they recruited a lot of volunteers. So what are the folks at the city doing to engage with those huge number of activists and people in the neighbourhoods who could help facilitate this process and maybe speed it up, just to get to keep the momentum going and ensure that we have that we actually get things done at the end of the day. We understand your resources are strained, but there's also a huge mass of available people who are interested in improving our transit, improving bike lanes and safe streets. So can we work with those people?
Yes, we can. I think that for sure, people who volunteer and also live in a particular neighborhood are the best people to work with, because they know what's happening on the ground. And regardless of whatever analysis we do, they'll still know more than we do at City Hall. The issue is to figure out a way to engage them, given our resources. So I'm sure I can work with the Mayor's Office of Neighborhood Services and some of our own team members to find ways to have a more robust public engagement process that takes advantage, I wouldn't say takes advantage, that's a very bad phrase, apologies, but works with local volunteers to get things done.
I think taking advantage is not a bad word in this context. There's a lot of local know-how and a lot of people who are very passionate. I think a partnership, making it a partnership and not an us and them situation is really helpful.
In some cases, we have done walkthroughs with local restaurant owners, for example, or local community groups. So we'll try and continue to do that, and then use that as a stepping stone to engage community people more collaboratively.
Yeah. I'd really encourage you to be the collaboration piece and the working together. I think you get more done at the end of the day.
I agree. It does take effort to collaborate, but we'll.
And in this modern context, in COVID, there was a huge amount of collaboration that happened across the board, and so many different entities and agencies. It was like all hands on deck, and we're still in it, but all hands on deck to get something done. I certainly can speak for the Alston Brighton community and know that there's a lot of folks very interested in making progress in this area. And if you want to use this as a pilot for community collaboration, I think we'd be signing up for it. Thank you. And really, the bottom line is that we want to see I don't want to see backpedaling on objectives and targets. Like, I really want to see progress in this area. The students are all away right now. I want to echo what Anna Leslie was saying. You know, our main streets are pretty empty right now, but we're expecting 17,000 students to arrive back in the next few weeks, and maybe not as many as usual, but that's the usual number of students that we have, 17 to 20,000 students living in this neighborhood. So it does make everything very congested. So anything we can do to improve the situation would be very helpful. Thank you.
Thank you very much, Councilor Braden. Okay, so Vineet, was there anything else you wanted to comment on just before we start?
Very briefly, but I do want to make sure that everyone who was in the wait room also has a chance to speak. But I just wanted to say to the advocacy groups that made brief statements at the beginning, we really, really appreciate your recognition of the team that's here in front of you, of the hard work that we do. So thank you for that. But I will say that there are other people as well in our departments, whether they are people in our operations department, whether they are people in our engineering divisions who are not in this meeting, but who work equally hard. And I will make sure to convey your thanks to them as well. So thank you for that. I just wanted to say that we do have a kind of a systemized way to do this when it's not that there's no plan. We did, when we started this Healthy Streets initiative, make a very tangible and explicit and discrete list of things that we would do. And we have been focused on those in the last few months. So there was a plan and there was a way to move forward, and we've been following that plan. Similarly, we'll be making an announcement about what we plan to do next. And then a lot of that planning is based on feedback we've heard from all of you, on feedback we've heard from community groups, and we'll be making that public as well going forward. So I just wanted to say that that's something that's definitely kind of an organized way that we are looking at doing things. I have a list of all the things that other people have mentioned that we haven't addressed, but I do want to give a chance to other people to speak as well before I try to answer those. Thanks so much.
Thank you, Vinny. I appreciate that too. I'm going to save my questions till the very end so we can go back and forth after public testimony too. Okay, so first three folks will be Jaheem Dwyer, Amber Johnson, and Chevelle Olivier. Jaheem, are you on? Let's see.
Yep.
Okay, go ahead. Thanks for joining us.
Hello?
Yep, we can hear you.
Hi, everyone. My name is Jaheem. I'm a vigorous student at Mattapan Food and Fitness Coalition. And at the moment, I don't have a car, so I use my bike as transportation. And I like to go to places such as like the park, the store, my grandma's house. I bike with my family sometime, and I also ride my bike to work. And I think the change on Commons Highway is a good idea because it makes the bikers like me feel safer on the street. Before the pilot thing, I used to ride on the sidewalk because I felt safer riding on the sidewalk beside the street. And yeah, I think it's a good idea because it makes the street available for everyone.
Thank you very much.
That's it.
Thanks. Amber?
Hi, everyone. Are you able to hear me?
Yes, we can hear you.
Perfect. Thank you for the opportunity to provide comment. My name is Amber Johnson. I'm affiliated with Livable Streets, and I would like to advocate for desperately needed improvements to Columbia Road. Livable Streets has been working closely with Columbia Road partners such as Bowdoin Street Health Center and Dorchester Bay EDC to ensure that Columbia Road is a priority corridor in both Go Boston 2030 and Imagining Boston 2030. Yet, there has been no progress. The city has included Columbia Road in the budget for the last 3 years, yet nothing has happened on the corridor. Additionally, we've been told that the city will be hiring for a corridor planner position to work on Columbia Road. My question to the councilors here today is why has that position remained unfulfilled for the past 2 years? While the city has made some progress, they've largely focused on streets downtown and ignored the corridors that have needed long-awaited improvements, such as Columbia Road, American Legion Highway, Warren Street, among others. But today, we're desperately asking to have some answers to the long-awaited questions and short-term improvements to corridors such as Columbia Road, especially during a time as COVID, where all of these issues in terms of traffic safety, transit reliability, and general public safety, as mentioned earlier, can be addressed through these improvements. Thank you.
Thank you, Ambar. And next is going to be Chevelle. And after Chevelle, I'll just call the next three names. Gary Chin. And Gary, I see, I'm sorry I don't have the name of, I see someone there with you, so I'll count you as both of you as two. And then Vivian Ortiz.
Thank you, Michelle. Okay. Good afternoon, everyone. My name is Chevelle, and I'm here as a Mattapan resident on behalf of Mattapan Food and Fitness Coalition and as the Community Engagement Coordinator at Livable Streets Alliance. All three of my roles inform me on what needs to be done to better the streets of the Mattapan community. As most of you know, COVID-19 has made the city more aware of the things that I already knew existed in Mattapan, such as food insecurity, no choices between using different modes of transportation, and housing insecurity, which is why I work where I do. And I do want to find a way to get more resources in this beautiful neighborhood that I do call home. As a resident, I'm super excited about the work that is being done on Commons Highway. I do not own a car, and I am a little afraid to use transit now, and I often use my bike to get around as well as walking. And with my bike, I don't have fear that I will contract COVID because I'm in the air, I'm around, it's open space, but I still do have to worry about sharing the streets with drivers and walkers. When I heard that the pilot was going to be done, I couldn't believe it. I thought to myself, now I have an option between 3 grocery stores instead of 1. Now I feel much safer biking on Cummings Highway because there's a protected bike lane. And now I know I have another route I can just take to ride my bike around with no particular destination in mind. As the Executive Director of Mattapan Food and Fitness Coalition, our vision is to see Mattapan streets clean, walkable, and bikeable. The Healthy Streets Initiative focusing on Mattapan streets helps my organization continue serving their mission by improving the physical environments for a healthier lifestyle for all. The bike work that our young people do called the Vigorous Youth in our organization, that our organization lead would be that much more valuable. And you heard one of my young people, Jaheem Dwyer, speak earlier. He's a Vigorous Youth with us. And lastly, as the Community Engagement Coordinator at Livable Streets Alliance, we lead a program called Street Ambassadors, which Stacey mentioned earlier, where community residents go out to hear what their neighbors would like to see on their streets. The street ambassadors, who are experts on their streets, have been collecting stories from those traveling on Cummins as well as American Legion Highway. Based on what street ambassadors have heard from their neighbors and those traveling along American Legion, there's another corridor that should be considered in receiving healthy street treatments. With 29 crashes in 30 days on American Legion between mid-May to mid-June, there's a high need to slow down cars and improve safety for those who are walking, biking, riding the bus, and driving. Given the significant safety concerns of the street, we wonder why the city has not yet done anything on the street, but we've heard that some things were happening earlier. And if any of our street ambassadors are here, I would like to invite them to share what they heard on each of these streets, Cummins Highway and American Legion Highway. Thank you.
Thank you, Chevelle. As I stated, next, before we go to Gary, I want to make sure to get in Councilor Edwards, who has another commitment at this time. So quick closing statement from Councilor Edwards, and then back to public testimony.
Hi, I just want to say thank you for this wonderful hearing. I hear some commitments from the city, and I really do think it's a matter of a big tent right now to address some of the tension that Councilor Mejia discussed, and also the fact that the city workers are working extremely hard, but so are the advocates. And I think committing to a common vision where people can move around Boston easily, that we are dedicated to a green vision, that one is looking at alternative ways that don't depend on fossil fuels. All of those things combined, I think, make for an equitable city that is growing. And I just wanted to echo again, I find that the initiatives that the city's doing is great, but it's amplified by really talking to the folks on the ground and advocates as well as people in the community. It can only increase how good and effective these programs are. So I look forward to, I'll reach out to you about a public statement for the blue, for the Blue Line having a car for bikes, or at least bike-friendly car. And thank you so much for this time. I'm going to now get prepared and work for the cannabis hearing that's coming up. Sorry, I had to plug in that, Michelle. As we were discussing equity, we'll be having a hearing at 3:30 on cannabis. Sorry, Michelle and Liz. Take care. Bye.
Thanks, Councilor Edwards. Okay, yep, we got our stop, so I'm gonna keep us going here. Gary, and introduce us, Gary, to who's with you.
Yes, I'm gonna let Garland introduce himself first. So hi everyone, my name is Garland. I live in Jamaica Plain and I'm a high school student. I bike, I work at Bikes Not Bombs, which is a nonprofit organization around just like bicycling and outreach and trying to use bicycles as a way to, as a tool for social change. So yeah, I became involved through Success Link, which is the job thing through the city. And yeah, I love biking. I'll let Gary introduce himself.
Yes, my name is Gary Chin. I work full-time for Bikes Not Bombs, and we're an environmental justice nonprofit in Jamaica Plain. Garland and I did some surveying on American Legion Highway in Mattapan, Rosendale, and we noticed that there were two major concerns that kept getting brought up as we were surveying the public. The first one was that speeding seemed too easy to do. Residents are frequently concerned about speeding cars. And then the second major concern was the fact that pedestrian, bus, and bicycle infrastructure is lacking. It seemed that like the road was purely just for driving and motor vehicles, and there was lacking, especially around bus stations. It was just a sign post, and then people would just have to stand around, and there wasn't any cover, there wasn't any like place, there wasn't any seating. And for pedestrians, there were very few crosswalks. And with bicycles, on one side, it was a breakdown lane. And then on the other side, it was also a breakdown lane, but it was right next to a mall. So cars would go into the breakdown lane to try and skip traffic and get into the mall parking lot and out of the mall parking lot. Yes, and the bike lane actually becomes sharrows after you get into, get out of the shopping area. And while the placement of the sharrows is fine, cars are so used to speeding that they ignore the paint that's supposed to protect the cyclist. And Garland and I spent maybe 15 seconds trying to get from the shopping area to Walk Hill Street, and we were actually almost struck by an impatient driver who didn't leave sufficient room while passing with the car. I feel like the lane is like too wide and cars are like trying to cut around you getting into it. We have spoken to people who have had their cars hit and run, and the speed limit exists, but it's not enforced, and the design inherently allows for speeding. We've also noticed that the sidewalks transition from narrow to wide and vice versa at random points, and there's no shade, especially for people who are at the bus stops. There were some people who were sitting on the curbs at the bus stops, and they were standing in the median to cross the street, waiting for the 2 lanes of traffic to allow them to cross. And then we have a few recommendations for you.
One recommendation is make improvements this fall addressing speeding and other safety concerns. Widen the sidewalks to create a protected bike lane, and create a protected bike lane so cars can't cut through, endangering both pedestrians and cyclists.
Maybe add new crosswalks where people are currently crossing, especially where the shopping area is. Use bright paint to designate those, or use street art to kind of beautify the area so that cars will slow down. Create covered bus shelters at popular bus stops along the corridor. We did have one person take the survey and say people think it's a highway, but it's not a highway. And the name itself, American Legion Highway, suggests otherwise, and this encourages dangerous driving. We've thought about American Legion Parkway or Boulevard, but any variation that doesn't suggest it's a highway would definitely help. And we feel that the Healthy Streets Initiative is a good start, but permanent solutions must be implemented to affect real change. And we just want to point out for the Columbus Ave redesign with the bus lane, Bikes Not Bombs and other members of the community, I think Mass Bike as well as a few other organizations weren't reached out to until after the plan had been finalized and was starting to get set into motion. So there were a lot of community concerns that weren't really addressed during the planning. Yeah, and we feel like when major redesign projects are being set into motion, we need to include those community partners, organizations, and key residents who really know what changes need to be made. Thank you. Thank you.
Thank you, Garland, and thank you, Gary. Next up will be Vivian, then Vivian Ortiz, William Higgins, then Rick Yoder. Vivian?
Okay, hi guys, I'm back. Here I am talking about the situation in my neighborhood. But first of all, Stephanie, I want to say thank you for everything that you're doing. And thank you for mentioning the fact that this pilot that we have on Cummins Highway was not as a result of the death of the gentleman that was killed on June the 9th. Many of us know that this was something that was already on the plan. The 3 meetings that we had beforehand, the pilot was set up afterwards. The day that the gentleman was killed was really, really hard for me. And I got a lot of wonderful messages from the bike community calling to see how I was doing. This is the first time that we've had a fatality of a person riding a bicycle in Mattapan. And I was always really afraid that that was going to happen before we had any improvements. Right after that, I called Stacey and I said, we need to do something because the video that was taped of the scene after the gentleman was killed had residents of Cummins Highway whose voices were very clearly heard in the video talking about the fact that the city needed to do something. I heard a mother say, I don't let my child ride the school bus because the people on Cummins Highway are speeding. The woman that saw the crash happen that had been walking her dog that morning, I'm still looking for her because she saw what happened. This morning when we were out there, we spoke to a gentleman that I'm hoping is going to be able to join that told us about how the crash happened, okay? So I am part of the Livable Streets Board. And a couple of years ago when we were looking at making the Alston-Brighton bike and bus lane, I did travel from Mattapan to go out there and talk to people that were using that space because I wanted to have something like that in Mattapan. So I went out there that morning, I remember it was pretty chilly, and we talked to people as they were waiting for the bus to ask them what their commute was like. And so that model of street ambassadors, now that I'm a board member, I said, Stacey, we need to do something.
I always feel like
Julia, you're not muted. Sorry about that. We need to do that because the response that I got when I called to the city to say, we need to do something to make sure that the folks on Cummins Highway know that this project is happening, because I could hear their voices in the background. They had no idea this was going to happen, right? So called Stacey, we got the street ambassadors, we were able to get some residents from Mattapan, some folks from Roslindale, and so we're working on the American Legion and Cummins Highway project. I love talking to people, y'all know that, and I love talking to people in my neighborhood because I knew that what I felt in my heart was correct. The engagement to the people that lived in Cummins Highway, and this is something that happens, we do this ourselves in our neighborhoods. We do not include folks that live in apartment buildings. We tend to not talk to people that are renting. We only go to the neighborhood associations, we only talk to those professional meeting goers. And the professional meeting goers were the ones that were saying they did not want this project to happen. Unfortunately, they didn't want it to happen because it was going to inconvenience them, and they drive everywhere. So I was determined, even if we weren't going to get street ambassadors, but I was a little afraid to go out by myself. So for the last couple of weeks, we've been going out. So I just want to share quickly what I've heard from some people. First of all, this is the way I do it. I wasn't going to walk around with a clipboard. I wasn't going to walk around with the survey. I know that in Black and brown communities, a clipboard and a survey mean, who the hell are you? What do you want to know? I don't know you. So I immediately this is the way I do it. Hi, my name is Vivian. I live in Mattapan. I do not ride my bicycle there. I live in Mattapan, and I just want to talk to you. Did you know this was happening? How did you find out? Did you know there were 3 meetings that took place? Overwhelmingly, the answers are no, no, no. Do you have a second so I can explain to you what it is that we're doing here? And then I go with it. I start with Go Boston 2030. I have copies of the Go Boston 2030, the 2 sheets. Councilor Mejia, I can share those with you, where it shows that Cummins Highway is part of the Go Boston 2030. And we're continuing to walk. I explained to them, first of all, this is not a bike project. This is a safety project. We are doing this for all users. If the person is walking, by the way, we're not knocking on any doors. So we're whomever we meet on the street. Let me walk with you. What does it feel like for you when you're walking? What was it like before? And you know that you have a car that's going 45 miles per hour in a 25 mile per hour speed limit area that close to you. Scary, scary, scary. All right. So explain to them, you know, if you have all that space, then you can take all the space you want and you're going to speed all you want. So instead of using the word road diet, they're not going to know what that is, kind of the concept. Pay attention to what's happening. Honestly, I was afraid that when this first happened, that it was like the worst time to do it because there were not a lot of people out there, right? And I thought, my neighbors, the folks at the meetings are going to say, why are we doing this for bikes? Nobody in Mattapan rides a bike. Look, there's no one out there riding a bike. And I have been pleasantly surprised to see how many people are out there walking, using their bikes. Fortunately, can't talk to them because they're like Zooming, so I haven't been able to talk to my fellow cyclists to find out how they're feeling about it. Spoke to a travel nurse that was waiting for a bus. She's from Houston. The family she's living with, I already told her, no, this is not a good thing. I explained it to her. She's like, I get it now. This is a safety thing. People think it's a construction project. They think that it's just something that's going to be there for a short time and go. By the way, a lot of them did receive the flyer that Daniela from Boston Transportation Department led the efforts to make sure that the folks on Cummins Highway had it. But the flyer is one thing. Not having been able to go to a meeting and really kind of hear how it was all thought through is what they're not sure of. On the day that it happened, my dear friend Lee from Milton was out there. When I got out there, it was just incredible to be able to ride in a protected bike lane. I was about to cry, and it was incredible. So I met a mother that had 4 kids. They were riding on their scooters. And I said to them, you can now ride in this space and feel safe about doing it. I've explained that the sidewalk is going to be extended. I've explained the fact that the bicyclists are going to be on that same sidewalk. Mireille, one of our street ambassadors, and I rode the 30 bus.
I'm
yes,
so sorry to interrupt.
Okay, I gotta finish.
Because we have a 3:30 hearing, I want to keep this going.
Okay, so I've ridden the 30 bus. We've talked to all these people. We've talked to businesses inside. The majority of the people that are on Cummins Highway like this, they get it, they want it, but they didn't understand it. So we need to make sure if we're moving forward, we're talking to the folks that are most affected by that. Thank you so much. And now we're going to listen to one of the neighbors that we spoke to that lives on Cummins Highway. Thank you.
Thank you. So we'll go next to Mr. Higgins, and then I think we have I counted, we have about 11 people left, and the next hearing's at 3:30. So if everyone can kind of aim for 1 minute, then we can finish just in time. Thank you.
Okay. Hello, my name is Bill Higgins, and I'm I guess a 30-plus year resident of Cummins Highway. I have quite a few concerns about the project that's happening now. One of the things that I wanted to mention was that before the proposed changes are made, there needs to be clear signage. You know, no parking, street cleaning, speed limit, whatever. Another problem will be the snow removal. I'm a 68-year-old man, and I remove the snow myself from the sidewalks, but if they're expanded, I'm going to have a problem. Lastly, we have a 92-year-old mother living in this house and a legally blind son. Liquor store patrons and the funeral home visitors routinely park in our driveway. If something happens to our mother and we have to get out of the driveway quickly, well, we're screwed. We shouldn't have to confront the violators to explain to them why they shouldn't park in our driveway. That would risk possible violent confrontations or retaliatory damage to our property. The city must institute a zero tolerance policy for blocking a driveway. Big dollar tickets and fines should be assessed to the violators. The surrounding businesses need to have a video feed of the driveway or access to something like the Ring doorbell system that monitors the neighborhood. We've been told that there's plans to eliminate the median strip. And in view of the numerous accidents that have occurred within porch view of our home, we think that's a bad idea. That's basically what I wanted to say. Thank you for allowing me to speak.
Thank you very much, Mr. Higgins, for joining us. Okay, next up will be Rick Yoder, Lisa Beatman, and then Janae, or it might be Jana, but we'll go in that order. Rick? And again, I'm gonna start to be really disciplined about moving people along if we can, because we're aiming for the next hearing to start at 3:30. Rick, are you still on? Oh, I think you're muted. Let me try to unmute you. Hold on. Yeah, Rick. Oh, okay, I think it's good now.
Okay. Yeah. Rick Yoder, represent a co-chair of Mount Hope Canterbury Neighborhood Association along American Legion Highway. I wanted to thank you, Michelle, for holding the hearing and for the turnout we had from the rest of the council. And I love Vivian's Ortiz presentation. Thank you, Vivian. Also, we wanted to thank Stephanie Suskin for the effort she made a few years ago coming out to our neighborhood, spending many meetings, doing tours, and awarding us the Slow Streets grant. It's really, the neighbors are so happy about that coming, and their testimony that was presented was, I think, very strong. We have a lot of problems out here. American Legion, of course, is not covered by that, and it's a 4-lane, fast-moving roadway, a lot of commuter traffic. We're in the, what is it? We rank the top 3% in Boston's most dangerous streets. It's on Vision Zero. Very dangerous intersections. We've been complaining about this for decades. And most recently, a lot of very specific suggestions and questions with livable streets. In the past, had two studies of it by Northeastern University, and not one word of feedback. Like, no replies to one of our letters. Like, please start talking to us. What isn't being planned? Why not? There's some intersections, real cheap fixes to make them safer. One is, I think, I spent a lot of time looking at it, Mount Hope Street in American Legion. Jersey barrier, 4 solid bollards, and a street sign. That's not money. Come on. Let's talk about it. I might be wrong in my analysis, but can someone there give me a call? You know, let's talk about it. Walk Hill, there was a fatality there 3 years ago. The rapid response from the city, which was great. And someone pointed out, you know what this needs is a traffic light hung from the center so that the travelers on Walk Hill can see it. Because right now they had the posts on the side with poor sight lines. You have to get up pretty close to American Legion before you can see them. Where is it? It's not there. That's, you know, that's more than a couple of bucks, but still.
Thanks, Fritz. Do you think you can wrap up?
Okay, thank you very much for your time, and thank you for the hearing.
Okay, thanks. Really appreciate you, and I will just emphasize that message, which seems to be directed to BTD. Lisa? Yes. Lisa Beatman?
Yes, can you hear me?
Yes, we can.
Thank you. I will be very brief. I will quote the former director of the Lena Park CDC, Kim Simmons, which is the community center and all the affordable housing that is on the Boston State Hospital land, thousands and thousands of majority, minority, low-income people. They had an exciting arrangement where they had a dentist. They had some arrangement. A dentist had agreed to do free dental work for the children, and each child who had a dental appointment would get a free bicycle. And what Ms. Simmons said to us is that none of the parents would allow their children to use their bicycles. They live across the street from Franklin Park. There are schools right there, the Brook Charter School. There is the community center, and there's the Boston Nature Center, which is half a mile away, and the children were not allowed to use their free bicycles. This is outrageous. And you've all heard from me before, so I will leave it at that. Please fix American Legion intersections, roadways, and sidewalks.
Thank you very much. Thanks, Lisa. Okay, next up is Janae. Is Janae still on? Okay, actually, I think I don't see that name on the list anymore. So after Janae was Adam, then Gassendi, and Sarah Freeman.
Hi.
Adam? Hi.
I'll be as quick as possible. I want to mention a couple of things. Car-free streets don't harm businesses, and there's data from all over the world and the USA that prove that. But also you can think about it, and if businesses would fail on car-free streets, then why are they failing all over Boston right now when we allow cars practically everywhere? And I really think Copenhagen is a really perfect example of a model we can follow. They have the Stroget, which is one of Europe's longest car-free pedestrianized streets. And being lucky enough to be able to visit there, like businesses there were booming. So I just really want to make that point that car-free streets don't harm businesses, and Boston could be one of America's sort of examples of how to do that and create a very long car-free street connecting from Newbury Street through downtown to the North End. I love the protected lanes that have popped up, but as Becca mentioned, there's connectivity gaps, especially through Dorchester, Mattapan, Roxbury. I live in Dorchester, and going down Dot Ave, 90% of the times I pass cars, so it's already a terrible road to drive on. Even when I drive, I drive from Dot Ave to Dot Ave, I don't use Dot Ave for that trip. So I think Dot Ave is a perfect place to either put in protected bike lanes or even just go fully car-free. And you know, I think everybody is aware that we're already a walking city. We already have that notoriety, and the more we can emphasize that, the better it is for businesses all across Boston. So I would really like to see that. Thank you.
Thank you very much, Adam. Okay, Gassendi? see if they're still here. Oh, it looks like they dropped off as well. So it would be Sarah Freeman, then Maria de la Luz Lobos Martinez, Michelle Weiner, and then I think that might be it. Okay, Sarah.
Hi, everyone. I'll be briefer than I planned, just echoing a lot of what came before. Bravo in particular to the young people from Mattapan, Food and Fitness and Bikes Not Bombs. I love hearing what you said and gives hope for the future. I appreciate what Boston has been doing and wants to make sure to do safely downtown and Cummins Highway, but I spoke at a hearing this morning on Columbus Ave and said it still feels in many places like the car is still king in Boston and bicyclists are second-class citizens. There are many cases where you have 4 lanes, 2 for moving cars, 2 for parked cars. And oops, sorry, nothing left for bikes. And that's just not okay. We've got to find more off-street parking or zip car or something and give the bicyclists a fair share. I'll leave it at that. Vivian, the street ambassadors, loved hearing that too. So cheers for everything. Let's do more.
Thank you. Thank you so much, Sarah. Maria?
Hi, thank you, Councilor, for letting me talk. Actually, I didn't raise my hand, but as I'm given the opportunity, I'm just gonna make it fast. I'm the Community Engagement Fellow at Livable Streets. I have been working in different projects throughout these years, and I just want to say that we need to stop making promises to people and start making the projects happen. I'm particularly interested in the Columbia Road project that seconding Amber. It has been very stopped, and we know there are fundings and there are opportunities there. So please move along and do stuff. We are supporting that effort. And the other thing is that I'm new to these meetings, but I do think it took a long time for let the community talk, and we need to give more space for all the folks to talk first, because I feel many of the partners that wanted to say something, they just left because it was 3 and this was supposed to be over. So that's everything I have to say. Thank you.
Hi, thanks, Maria.
Councilor Wu, I'm still here. I know I had to leave, but I stayed because Vivian asked me to stay to hear her testimony, and then I stayed to hear the rest of the folks speak, because I think it's really important for us to recognize that everyone has a voice, right? And we just, and we only have a small, limited amount of time to speak. And I would love to brainstorm how we can create opportunities for us to lead with the people. And I know as much as I like to hear myself speak, it's not about me all the time. So I just think that we need to think about how we create a different process for this.
Totally agreed. Thank you very much, Councilor. Okay, last person on public testimony was Michelle Weiner, or Weiner. Are you still here, Michelle?
I am. I was not signed up to give testimony, though, to the best of my knowledge.
Okay. Well, did you want to add anything while you're here?
No, I mean, I will echo, having worked with a little bit with Livable Streets and with Maria, just echoing what she said, that the many of the folks who I know were planning and hoping to make comments this afternoon have left and have had other obligations, particularly with our transition into virtual work. I know a lot of us, our meetings are packed pretty tightly back to back as we transition from Zoom to Zoom. And so just making sure that those voices are heard.
Thank you. Okay, and last but not least, Brendan, who has had his hand up since the panel.
Awesome, thank you so much. Just 3 quick things. Carol brought up outdoor seating, challenges and opportunities. The city has a map right now of places doing it. It would be great if that map included the permitted patios or seating plans that they submitted. They had to submit them digitally. It would be great if you could just look up and see what was actually permitted on that map. Next thing, we hope there's a mechanism for expanded sidewalk space for reducing crowding in the next Healthy Streets announcement. That would be great. And building on that, we're super concerned about snow clearance for people walking even more this year. especially since it is on business and property owners to clear the snow. What happens if the business is fully closed due to the pandemic, or if schools are fully remote? If sidewalks are covered in snow, people are going to be forced to walk in the street more often. It may be necessary for snow clearance to be taken out of the hands of businesses in certain areas. Maybe that means the city does it, but knowing the constraints on that, maybe give grant money to Main Streets groups to hire residents to clear out the shovels or a snow plow, so it begin more as a network and less piecemeal to create those safe connections for people to walk. Thanks so much.
Thank you, Brendan. Thank you, everyone. I know we're pushing right up against the next hearing, so I'll just wrap up by saying I appreciate all of you. There's so much expertise shared here and great ideas, and it's important for us as the council to not just have the first hearing, but keep doing the follow-up. And I think in some ways we got deeper, and I know that even by having this conversation, we'll make some of the plans that are in place go even faster, and more plans come to fruition as well. So, and I just want to add, as committee chair, I take full responsibility and say I'm extremely sorry. I know there are several people who wanted to be part of this, and you know, the discussion got pushed back, and so we are now beyond the end time. And so I'll think carefully about whether we can break it up into more specific topics next time and have more scheduled out, smaller, more focused discussions where people can kind of sign up for the sections that they're more interested in, or we do just a listening only session. But I will make sure that in future Planning, Development, Transportation Committee hearings, particularly when it comes to this issue and this topic, as we continue following up, that we will do better. And we want to make sure that we are leading by following the community. Okay, so any other comments from council colleagues or the administration before we turn it over to the other hearing?
Yes, I've got my hand up.
Go for it, Councilor Mejia.
I stayed longer, actually, and instead of staying for the whole thing, because I think it's really important, especially in this particular topic. I've always seen a disconnect in terms of just people who are living the realities, and I'm so glad that I got to hear from so many people who are doing this work and who are deeply passionate about this issue. And so really thank all the advocates and the administration for being here, and you, Councilor Wu, for your relentless commitment to transit justice. And I've learned a lot, and I'm really grateful to participate. And next time around, I love all of your recommendations. I think we need to, because this is a big conversation. It's unrealistic to think that we'd be able to hear it all in this short period of time. So thank you so much, everyone, for staying as long as you did, but I gotta go to another one. Thank you. Bye, everybody.
Thank you. Bye. And Councilor Braden?
Just very briefly, I realize everybody is on a tight timeline. I really appreciate everyone who came to talk to us today, the advocates, folks from the Transportation Department, everyone. I think it's a really important conversation, and I look forward to continuing it. This is not the end. We're only at the beginning, end of the beginning, not the beginning of the end. Thank you all so much. Thank you.
Thank you. I know there was much more we could have gone on to. We'll look forward to the upcoming announcements from Vineet and the team and continue working together. So this will conclude our hearing on docket number, I believe 0662, order for hearing on safe street improvements during the COVID-19 pandemic and afterwards. This hearing is adjourned. Thanks, everyone.